on this.
Hey friends, welcome to Thrive Line Healing Podcast. This is episode 136. And today we're going to kind of continue on our series. We've been talking about various health things. And this one, we're going to talk about autoimmune disorders and because we talked about like what weakens your immune system, the 4 things it did. And then we did a postpartum episode. And then this one's just going to continue on in that theme.
Yes. So the topic of autoimmunity is very large, right? It's a very large, there's over 80 different autoimmune disorders or diseases. So the goal of today's podcast is just to help to understand a little bit of the root cause, a little bit about our immune system, and what is changing in autoimmunity. Okay. Because autoimmune conditions range from things like rheumatoid arthritis, is one of the most common, to lupus, type 1 diabetes, ulcerative colitis, Crohn's, mixed connective tissue disorders, ankylosing spondylitis, MS. It runs the whole gamut. And why there's a lot of different types of autoimmune conditions is because it's the type of tissue within our body that's often targeted. So our body, what's happening is our body, the immune system is overreactive, right? Where it is now targeting our specific cells in our specific tissue instead of foreign things. Our immune system is designed to address things that are foreign, right? That's like bugs, bacteria, viruses, mold, fungus, parasites, things that don't naturally grow in our body. That's what our immune system is supposed to target. And then when it becomes triggered, it will often, and those triggers can be different for folks, but the immune response moves from now, instead of just targeting things that are foreign, if it is introduced to something that looks like our body, say 75-80%, the structure, the molecular structure looks like something in our body, then our immune system will start to form a response to it. So
I'm sorry to interrupt you, but can you give like a layman's term example? Yes. Right?
Yes.
Like,
so
the virus looks like this tissue, and that's what causes that specific, or something like that.
Yes, I can. So my first example is like rheumatoid arthritis. A lot of people are familiar with rheumatoid arthritis. There are 2 different components. There's a juvenile rheumatoid arthritis, and then there's an adult rheumatoid arthritis. But so that's where the immune system is attacking our joints, right? So instead of attacking things, oftentimes, and I'm totally going to make blanket statements here, but I want to give them with that caveat that, again, the trigger is different for everybody. For rheumatoid arthritis, oftentimes, because we're targeting joints, proteins in our food can be a trigger for some of the autoimmune conditions. So, for example, if people have a sensitivity to gluten, to wheat, to casein and dairy, some of those proteins in our food can look very similar to our own cells, right? So if we are ingesting those foods and our immune system creates a reaction to them that one time, and then when our immune system, those immune cells are floating around through our bloodstream, and it gets to our joints and says, hey, that tissue or those cells in our joints looks very similar to this protein we've been creating an immune reaction to. So then it will start to create immune reactions to the proteins in our joints.
Okay.
Does that help? Yeah.
Yes.
So it's the reaction is similar to any autoimmune condition. So the same thing, like the ones in inflammatory bowel diseases like ulcerative colitis or Crohn's, your immune system is creating a reaction to the gut, right? To the large intestine or the entire digestive tract, right? Things like MS are creating an immune reaction to the myelin sheath or to the nerves that are the myelin sheath around the nerves. So then we start to see weakness in our muscles. We start to see nerve pain. We see changes in our nervous system. Right. A common one that people have heard is like Hashimoto's, the autoimmune condition to our thyroid that suppresses our thyroid. It's our immune system attacking our thyroid, so we're not able to make enough thyroid hormone to be healthy. The opposite side of that is Graves, which is our autoimmune reaction that actually still attacks our thyroid, but it actually attacks it in a place where it stimulates too much thyroid hormone to be made. And so we get kind of both ends of the spectrum. But the, so does that part make sense?
Yes.
Okay, so the triggers, like for some autoimmune conditions, they suspect even things like type 1 diabetes. Oftentimes we get that as children, right? And it's a dysfunction in the pancreas because the autoimmune system is creating an immune reaction to the pancreas so that it is not able to make insulin in those, usually it's children. Mm-hmm. So one of the triggers for that can be viral infections, right? Babies get viral infections just like adults do. Sometimes that viral infection, and sometimes it doesn't have to be like a huge viral infection. Sometimes it can be just the flu. Sometimes it could be, sometimes for some folks, it can be a bacterial infection like strep. Or chronic ear infections in kids that can be viral or bacterial can trigger an autoimmune reaction that then moves into the pancreas, creating type 1 diabetes in kids. Okay. So you can see autoimmune conditions in men and in women. Women are a little bit more prone to autoimmune conditions.
Because of our hormone.
I suspect because our level of hormones are higher than in men. I mean, men have estrogen and progesterone and testosterone just like we do. But because our progesterone and estrogen fluctuate much more than in men on a monthly basis, I think that that's kind of what puts us at a little bit more of a higher risk, is because that progesterone is kind of our protective factor. So lower our progesterone, if we don't, balance out every month, that does make us more susceptible because, again, that influences that Th1 that we talked about a few episodes ago. So with things like, again, I mean, same thing with rheumatoid arthritis, with lupus, with even MS, we're often looking at those factors we talked about that weaken the immune system, because if we have a weakened immune system, that that kind of translates to your immune system isn't as focused, right? So it's not as focused, and so things can kind of get lost in translation, if you will, when it's creating an immune response, and it thinks it's creating this immune response to this particular virus, like Epstein-Barr virus, or like a tick fever, Rocky Mountain spotted fever, or
Lyme's disease,
Lyme, or Bartonella or Babesia. These are all infections that can trigger autoimmune conditions. Even now we're putting COVID into that category. And so your immune system thinks it's, creating a reaction to that particular infection. But if that infection or that those particles of that infection looks like our tissue, then, our immune system's actually creating a reaction to our tissue. But when we say that it's unregulated, right? Is that normally what happens, your body puts out these antibodies and this reaction, and then it kills that bug, right? And once that bug is gone, your immune system moves on to the next thing, right? But when your immune system is targeting your tissue, we've got plenty of tissue in our body. So then it never gets that signal to say, oh, okay, we're done. We can move on to the next thing.
Mm-hmm.
Does that make sense?
Yep.
Yeah. So that's what I mean when I say it's an overproduction, an unregulated immune response, because it's just kind of, creating this cycle, and it doesn't ever get sort of that stop point unless we make other changes, because we've got a lot of tissue. Yes. Yeah. Now, how to address it. So there's a lot of different, I hope that makes sense, is kind of the foundation. Yeah.
Yes, I'm just holding back on a lot of questions.
That's okay. Well, this
So go
is
for it.
time to ask questions before I talk about how like conventional medicine tries to treat autoimmune conditions.
That was going to be one of them, because I wanted people to understand, like, it's, and maybe you'll decide, like, the T1 to T2, and then why conventional medicine addresses and looks at it the way it does compared to your perspective, because they're extremely different.
Yes. Okay. So as far as conventional medicine goes, oftentimes when people have autoimmune conditions, and some of the medications out there have been targeted towards specific autoimmune conditions, but oftentimes they all have similar mechanisms. Okay. What they're doing is especially if somebody's in a flare, they want to suppress the immune system. Okay. Because we know, the steroids, and sometimes it's high-powered steroids.
Right? Oh yeah, with MS, like it's like 5 days of 1,000. I don't know the units. IV.
Yes. Yeah. If somebody comes in a flare, where they can't function, either they're in a lot of pain, or like ulcerative colitis, they can't have a normal bowel movement. They're having bowel movements like 40 times a day. If it's somebody with rheumatoid arthritis and they can't walk, get out of the chair, they can't walk to the bathroom. So they suppress the immune system with steroids. And it puts out that fire, right? Which needs to be done. The immune system's overreacting. Okay. Then they will try to move people into a maintenance phase. Okay. Most of the medications that are available they used to just be shots, but now they do have some oral medications. Most of them are monoclonal antibodies, or chemo drugs. Okay, so depending on where you are, if you're on an autoimmune journey, oftentimes I see folks who have been on things like methotrexate. A lot of the commercials on TV, I can't tell you any of the medications off the top of my head, like Remicade, anything that ends in an AB, the actual name, not the brand name, but like, they'll also give you a little, they don't always say it, but they'll write it on the screen. But if it ends in an AB, that's called a monoclonal antibody. Okay. So when I'm talking about our immune reaction, right, that's our immune system creating these antibodies against our tissue. Okay. And so when we introduce monoclonal antibodies, what that's doing is that's introducing those antibodies into our immune system, or into our body, in hopes that our immune system recognizes them and says, hey, we don't need to make any more of these antibodies. We have plenty of them. Okay. So when they do that, they're addressing the symptoms, right? Which, if people are in a flare, sometimes that makes sense. We want to stop destruction and damage of the tissue. So we've got to put out that fire. And so if that's what it takes, from my perspective, I want to work on the root cause. Right. I want to work on why your immune system is overproductive, over-triggered, right? In the first place.
Yeah.
And because we know the relationship of those T cells as part of the immune system, that Th and T1, if you think of it a lot like a teeter-totter, right? If our Th1 is high, you're going to be more prone to autoimmune conditions. If our Th2 is higher, you're going to be more protected. But if we're in balance, that's where we would like to be. Okay. So I talked about in the postpartum podcast that our progesterone is often very high when we're pregnant because it is produced from the placenta. And once the placenta is delivered, we have this huge drop off of progesterone. Well, progesterone promotes Th2, right, which is the protective piece of the immune system. So we lose progesterone, we lose Th2, and then our Th1 comes up. So maybe not in the postpartum woman, but if our progesterone is on the